I'm delighted to be able to talk to you about the European Society of Paediatric Oncology. We are, as the president of the European Society of Paediatric Oncology, we are the single united society for healthcare professionals looking after children and young people with cancer. And we work in close partnership between our professionals, parents, patients and survivors. And indeed, we have a memorandum of understanding with CCI Europe, the European Society for Patients and Parents, and an MOU with PanCare, which is the European Society for Survivors. And together we represent the many needs of children and adolescents with cancer throughout Europe. I just remind you that childhood cancer is a major health and socioeconomic burden. It remains the first cause of death by disease for children over the age of 1. 35,000 children are diagnosed with cancer every year in Europe, and more than 6,000 young people die every year. Of the survivors, over 60% experience a long-term adverse side effect that affects their daily lives as they grow up. We need to remember that childhood cancer is not just one disease, and it's a heterogeneous population with highly specific needs. Needs of the individual cancers and needs of the individual age groups, the children, adolescents and young adults, and indeed their extended families. And we must also remember the needs of the survivors. Each childhood cancer has a distinct age-related biological, clinical pathway that needs to be addressed. There are 4 major unmet needs in childhood cancer, if I could just summarize them now. Inequalities, that's a simple word that describes a multitude of inequalities in childhood cancer. There is unequal access to the best standards of care throughout Europe. Across east to west, from west to east in Europe, there's a 20% discrepancy in survival, and we must do more to improve the best standard of care in every centre, in every country across Europe. There's also a lack of therapeutic innovation. Most of the treatments we use today have been around for decades. And if you compare to the tsunami of new drugs that have been licensed for the adult cancer population, 150 new drugs in the last decade compared to only 9 for children with cancer. So we really must do more to improve development of new drugs for this patient population. 500,000 children with cancer are now cancer survivors in Europe, and that number is growing rapidly. And yet we still do not have in every country a well-organised surveillance system for the long-term side effects of these young people and the support and care they need to be able to live normal lives with the necessary support to deal with their health, psychological and socioeconomic needs. And the final and important aspect to remember is that these are vulnerable families, and we must ensure that patients and parent voices are heard throughout the course of their disease. We believe that the way forward is supported by many of the EU initiatives, both in healthcare and research. And we need these initiatives to address these inequalities in survival for children and adolescents throughout Europe. We need these initiatives to ensure that pan-European accessibility to best practice extends to diagnostics, treatment and long-term follow-up. And the Paediatric Cancer ERN, European Reference Network, is a great tool for this. And we need to see investment for stability in these European reference networks. And this will facilitate a framework to ensure that clinical trials that can change practice can be delivered throughout Europe. We need regulatory change and investment to improve access to innovative therapies. There needs to be changes to the regulations to encourage the pharmaceutical industry to invest their time and energy in drugs specifically for childhood cancers. And we need research funding for academia to improve understanding of childhood cancer and understanding how new drugs can be developed. We need investment to roll out appropriate long-term surveillance and care transition structures throughout the whole of Europe, A good example of this is the survivorship pathway, already initiated through funding from the European Commission, but now needs investment to implement it throughout Europe. And we must see real engagement for patients and parents and survivors in all aspects of healthcare, research and socioeconomic rights. And we need to promote empowerment and appropriate resourcing of patient and parent organisations. Multidisciplinary collaboration between all stakeholders is essential to meet all these needs. And initiatives like the European Code of Cancer Practice released by ECHO is a good example of how we can work together. Thank you.